reminded of a story a friend of mine told me about events at the university at which she teaches, about 70, 80 years ago. See, at that time, her university, before she taught there, of course, was engaged in what was viewed as a very novel and innovative social experiment. They were going to hire women as faculty members in the hard sciences, like chemistry and physics. This was considered very revolutionary at the time. And they discovered they had a little bit of a problem implementing this policy. The science faculty building had no women's restrooms in it. And of course, as soon as it became apparent that the university would have to pay to add in new restrooms to the building, the opponents of this new policy announced with a great uproar, "Look at how expensive integration is." Of course, today we realize that what's expensive is not integration, is not inclusion. It's doing it wrong the first time, and then having to go back and fix your mistake because you have left some people, some members of our shared community behind. And we have come to recognize that as it applies to having women's restrooms in the science faculty building, but there are so many other parts of our society with respect to disability and with respect to countless other aspects of our shared community where we have not come to that point of recognition. And I want to talk about that today within the context of autism and employment, which is the discussion topic that I was asked to say a few words to you about, drawing on my work with the Autistic Self-Advocacy Network. Where should we start? As we've heard earlier today, the status quo leaves a great deal to be desired. If you look at data from the U.S. Department of Education, 1 in every 3 autistic youth has no access to higher education or employment in the 7 years after they leave high school. Those numbers are even worse if you are African American or from the bottom income quartile. As in so many other aspects of our society, the disparities that face the autistic community are further compounded when they interact with other disparities in our society. So how can we approach changing this? How can we approach building more opportunities for autistic adults regardless of age, not just youth transitioning from school, but also the extensive generations of autistic adults who may not have been recognized until later in their lives, or who may still not have been recognized. Autism is not some new occurrence, regardless of what we may hear from that noted scholar of medical science, Jenny McCarthy. Apparently the University of Google now has a medical school. Who would have thought it? Autism is not some recent occurrence, but in fact we have always seen autistic people throughout our society. When the United Kingdom's National Health Service conducted a study to estimate the prevalence of autism in adults, they found the same prevalence, approximately 1%, as the prevalence of autism in children. That says that we need to be thinking not only about the younger generation, now coming out of school, but also about generations of autistic adults whose needs have long been neglected and who we only now begin to turn our attentions to, and who only now may understand their role and their involvement in our autistic community.